Hello and welcome to another video lesson. In today's video, we want to look at the anatomy of the tooth. So join me in this exciting journey as we learn about the structure of the tooth and its functions. So let's begin. The teeth are crucial components of the human body's digestive system. They are responsible for mechanically breaking down food into smaller pieces, which aids in the digestion process. Teeth are composed of multiple layers of specialized tissues that work together to support the tooth function. In the normal adult mouth, we have our 32 teeth, which have erupted by the age of 13, except the wisdom teeth. There are 5 groups of teeth, or the different categories of teeth. We have the incisors. There are 8 in total. These form the middlemost 4 teeth on the upper and lower jaws. Then we have the canines, a total of 4. These are the pointed teeth just outside the incisors. And then the premolars, 8 in all. These are the teeth between the canines and the molars. And then we have the molars, total of 8. These are the flat teeth in the rear of the mouth, best at grinding food. Then we have the wisdom teeth, or the third molars, another total of 4. These teeth erupt around 18 years, but they are often surgically removed to prevent displacement of the other teeth. So by the age of 18, we should have about 32 teeth in all. Right, so this is the anatomy of the tooth. On the right side, we see 3 regions of the tooth. We have the crown, we have the neck, and then the root of the tooth. So we're going to look at what the crown represents, what the neck represents, and then what the root represents. And on the left side, we have the detailed structure of the tooth that is labeled. We're going to look at the details of this in the next slide. So let's look at the anatomy of the tooth. So the anatomy of the tooth can be divided into 2 parts, the crown and the root. The crown is the visible portion of the tooth above the gum line, right? So this part here above the gum line, that is the crown. That's what is labeled here. While the root is a portion of the tooth that is embedded in the jaw bone. So that the portion here embedded in the jaw bone represent the roots. So these are the roots, okay, the roots. And then the portion between the crown and the root from the neck of the tooth. In other words, it will be somewhere around the level of the gum line. Now, these are the different layers of the tooth and their functions. First, we want to talk about the enamel. The enamel is the hard outermost layer of the tooth. Okay, that's the white part that you see here. That's the enamel covering the tooth, the hard part. It's the hardest substance of the body and protects the tooth from wear and tear. Okay, so that's a function, protects the tooth from wear and tear. They have the dentin, this is a layer under the enamel that makes up most of the tooth's structure. Okay, so this brown part that you see here, that is the dentin under the enamel. It's less hard than enamel, but still quite durable. Dentin is responsible for giving the teeth their color. Okay, so that's the dentin. They have the pulp. Now the pulp, this is the soft tissue located in the center of the tooth. So we have the pulp that's located here, or this part is the pulp. Okay, it contains nerves, blood vessels, and connective tissues that nourish the tooth and keep it healthy. Right, and they have the cementum. This is the layer of connective tissue that covers the root of the tooth. So the cementum covers the root of the tooth here. Cementum. It anchors the tooth to the jawbone and also helps to hold it in place. Okay, so that's the function of the cementum. Then we have what we call the periodontal ligament. Periodontal ligament. This is the tissue that attaches the cementum to the bone that surrounds the tooth. It provides shock absorption during chewing and helps to keep the tooth stable. But the main function is the shock absorption portion during chewing. Right. So overall, the different layers of the tooth work together to support the tooth function in the digestive process. Proper dental hygiene, such as regular brushing and flossing, can help to keep these layers healthy and prevent tooth decay and other oral health problems. Now let's test ourselves a little bit on the structure of the tooth with these multiple questions. Okay, so what do you know? Number one, which of the following is the hardest substance in the human body? A, enamel, B, dentin, C, pulp, D, cementum. All right, take 30 seconds to think about it, make your choice before I reveal the answer. Okay, if you chose enamel, congratulations. Right, so enamel is the answer. The enamel is the outermost layer of the tooth and is the hardest substance in the human body. It protects the tooth from wear and tear caused by chewing and other activities. The dentin, as we said, is the layer under the enamel. It's less hard than enamel, but it's still durable. The pulp is a soft tissue located in the center of the tooth, while the cementum is a layer of connective tissue that covers the root of the tooth. So the correct answer is the enamel. Now, what is it? Number two, what is the function of the periodontal ligament? Periodontal ligament. A, provides shock absorption during chewing. B, it nourishes the tooth and keeps it healthy. C, anchors the tooth to the jawbone. And D, it protects the tooth from wear and tear. All right, make your choice. All right, I believe you have your choice now. Okay, so answer is A. It provides shock absorption during chewing, right? During chewing, right? Okay, so what's the rationale here? The periodontal ligament is a tissue that attaches the cementum to the bone that surrounds the tooth. It provides shock absorption during chewing and helps to keep the tooth stable. It does not nourish the tooth, right? It does not nourish the tooth, so B is out. Or it doesn't protect it from wear and tear either. And while it does anchor the tooth to the jawbone, it is not its primary function. All right, so the primary function is that of shock absorption. Number three, which type of tooth is responsible for cutting and tearing food? A, the incisors, B, canines, C, premolars, and D, molars. So which of these is shaped like a chisel, right, for cutting? So the answer is going to be A, the incisors. That's the shape like a chisel shaped. So it's good for cutting and tearing food. Number four, which type of tooth is responsible for grinding and crushing food? Grinding and crushing food. A, incisors, B, canines, C, premolars, and D, molars. Select your answer. Right, D. D is the answer. Molars. The molars are best at crushing and grinding food. Number five, which layer of the tooth contains nerves and blood vessels? Nerves and blood vessels. A, enamel, B, dentin, C, pulp, D, cementum. 30 seconds. Make your choice. Okay, the answer is C, which is the pulp. Pulp. The pulp is the soft part of the tooth containing blood vessels and nerves and connective tissue. Okay, so as we said, the health of the tooth depends on the pulp. Number six, what is the term for the hard deposit that forms on teeth due to a buildup of bacteria? A, plaque or plaque. B, tartar. C, decay. And D, cavity. Right, the answer is B, tartar. Number 7, what's the term for the loss of tooth structure due to acid produced by bacteria? A, plaque. B, tartar. C, decay. And D, cavity. Ready for the reveal? Okay, the answer is C, decay, to decay. Number 8, which type of tooth is often referred to as a eye tooth? A, incisors. B, canine. C, premolar. And D, molar. 30 seconds to go. Let's reveal the answer. All right, B, canine. B, canine. So the canine is known as the eye tooth. All right, so today we've learned something new. The eye tooth, canine. Number 9, what is the term for the surgical removal of a tooth? Surgical removal of a tooth. So make a good elimination and choose the correct answer. Okay, let's go. A is extraction, B, filling, C, root canal, and D, crown. Okay, so here the answer is extraction, to extract something, remove something. So removing a tooth is extraction. Number 10, what is the term for the dental restoration that covers the entire surface of the tooth? A, filling, B, crown, C, bridge, and D, implant. So the answer here is going to be crown, which is B. Number 11, what's the term for the tooth, for a tooth that is not properly aligned with the other teeth? Properly aligned, not properly aligned. A, impacted. B, decayed. C, malocclusion. And D, abscessed. Okay, let's go for the reveal. C, malocclusion. Malocclusion. Number 12, what's the term for the tooth that has not emerged from the gum line? Has not emerged from the gum line. A, impacted. B, decayed. C, infected. D, abscessed. 30 seconds for the reveal. Ready? Let's go. A, impacted. Impacted. So that brings us to the end of this video. Hope to see you again in my next video. Enjoy. Bye-bye.